Hello, everybody. My name is Arturo Solis-Herrera, and I will talk about the unsuspected capacity of human body to dissociate the water molecule, like plants, and its implications in ophthalmology. The three main causes of blindness worldwide: age-related macular degeneration, the first cause of blindness in sunny countries. Second, diabetic retinopathy, the first cause between 15 to 65 years old. And glaucoma, third cause of blindness in cold countries, and first in sunny locations. Since the first half of past century, their prevalence and incidence had not been modified, despite impressive technological and pharmacological advances and the efforts of research, clinicians, and patients. Therapy, available treatments are not working at all. Current ophthalmic physiology is based on biology deeply rooted dogma about that main source of energy in human body is glucose. This is an erroneous belief dates back to Lavoisier and Presley, where it was proclaimed that our body combines the oxygen we breathe with the glucose so we can get through meals in order to have the necessary energy to drive all the chemical reactions that make us up. There are a lot of contradictions about glucose. For instance, photosynthesis in plants supposedly stores the sun's energy in covalent glucose bonds. But energy cannot be stored, is either used or lost. Glucose is distributed to the body through the blood vessels. However, there are metabolically very active areas which don't have blood vessels. For example, the bone marrow produces between 1 and 2 million blood cells per second. In the eye, we have some examples. For instance, the photoreceptor layer. Only this layer needs 10 times more energy than cerebral cortex, 6 times more energy than cardiac muscles, 3 times more energy than kidney cortex. The ocular flow per minute is 150 milliliters per minute. Only 2% of these 150 milliliters is driven by retinal central artery, and no one blood vessels under normal circumstances in the photoreceptor layer. So, where the energy that photoreceptor layer comes from? And I have the answer: the choroid layer. Because the human body has the unsuspected intrinsic property of dissociate the water molecule as plants. Look, in plants, the process from liquid water to hydrogen gas and oxygen gas. And in human, it's the same process, but is several times more efficient because in plants, the water dissociation is irreversible, but in humans is reversible. Glucose is the universal building block out of discussion, and the human body is supported by glucose. But glucose cannot provide the energy that its own metabolism requires. It's something like a cartoon. It's not possible. Glucose is a universal building block. That's it. But if glucose were a source of energy, diabetics patients should fly. Glucose is a unique molecule, indispensable for life. All living beings contain it, but it cannot provide the energy that its own metabolism requires. It's not possible. So I will show some examples of the therapeutic results we are obtaining, starting from the fact that the source of energy of human body and thereby of retina is the water dissociation and not glucose. This is a macular hemorrhage, typical macular hemorrhage that suddenly appears in these female patients. Relatively young because it's 45 years old, and with our therapeutic strategy. The first examination, 1 week later and 3 weeks later, the patient recovers 95% of vision. This is the typical appearance of subretinal membrane. Distorted of the vision and 2200 of a visual acuity. And after 3 weeks, the vision improves to 20/25. Other example of hemorrhage macular area, and with the treatment, after 2 months, the hemorrhage disappeared gradually. This is the comparative images. We treated this patient in France. This area is macular affected by edema in a patient of 65 years old. And the OCT in October 2009 shows the empty space typical of edema. And in September 2010, the macula is completely recovered. In this example of macular degeneration exudates edema, pigment activation with impaired vision, and 3 months later, the improvement is significant. This is a complicated case of highly myopic patients with problems around the optic nerve and sudden hemorrhage in macular area. And gradually the hemorrhage disappears with minimal scarring. This is other example of hemorrhage in macular area. This patient was examined for the first time in October 2018, and 2 months later, the hemorrhage disappeared, and the recovery of tissues is significant. And we have a good news. The macular degeneration is considered the Alzheimer of the eye. In the risk factor are the same, the age are the same, the histological section is very similar, and the Alzheimer is a growing problem. Every 4 seconds, there are a new Alzheimer patients. It's a progressive. There is no treatment, so new therapeutic approaches are desperately needed. And in the aging population, 2 of the most common neurodegenerative diseases, AD and AMD, could simultaneously be treated or prevented with a single therapeutic intervention. Of course. Therapy will begin to treat Alzheimer patients, like these patients, in April 2013. And in December, the improvement is wonderful. The aggressivity characteristic of the Alzheimer patients, depression, fears, and 2 months later, the improvement is wonderful. These patients needs careful 24 hours a day. Look the expressions of the relative, and 2 months later, the improvement is fantastic, and the expression of the relative is much better. This patient with the Alzheimer's ID diagnosis since 2007, and first examination December 15, 2010. 6 months later, the improvement is in all these fears of mine. Other examples of aggressivity first, and 3 months later, the patient is relaxed. In September 2010, we saw these Alzheimer patients. Aggressivity first, depressions, and 2 years later. It's fantastic. It's amazing. The problem is resolved. We are treated patients with ID in both sex and several ages. An improvement is significant. Like this patient, in November 2012. And 2 months later. Other example, depression, fears, aggressivity, and some months later, these patients with forgetfulness and ID incipient or moderate ID, but the improvement appears relatively fast. Now you believe me? At any age, the improvement is significant, is easily appreciated by the relatives and by the physician. This patient was treated in Canada. ID and furthermore an ulcer in the nose tip. And with our treatment, improvement gradually but fast appear. Several months later, even the nose tip ulcer also disappears. This patient's Alzheimer from USA, March 29, look at depression and the 1 month later, it's incredible. Look at and this is a relative of the previous patient that has a problem with lids, diagnosed with ocular myasthenic problem. So the patient decides to use the same treatment, and 1 month later, the problem disappears. And we have a good news also in corneal transplantation. This is a third corneal transplantation that is rejected. And after 6 months of the same treatment, the improvement is incredible. So don't forget, the energy to the human body, to retina, comes from light, not from glucose. That's it today. Thanks for your kind attention. This is our emails. This is our website. Thank you very much. Bye-bye.